Welcome to my channel. Let's review my current medical struggles.
Good afternoon, everybody. So it's actually 12:07 here. It's 13:07 back home, or maybe earlier, maybe 11:07. I don't remember. But there is a time difference between here and the U.S. So yeah, trying to make sure my camera is going to play with me today. Sometimes it likes to follow me, sometimes it don't. So anyways, hello everybody. So let's talk about some trials and tribulations that I've had lately. I have been home, or I have been dealing with some issues since the 23rd. I think today is the 7th or 8th or something. I don't know. Whenever I'm put on quarters, as we call it in the military, or bed rest for me, whenever I'm put on bed rest, I tend to forget the days of the week. So let's look at the other phone so I can figure out what today is, because I have no idea. So today is the 8th. So I have not posted in a while because, like I said, since October, I want to say like October 23rd, I've been dealing with some complications. So I think I've talked in previous videos that one of the things that I had been dealing with was the fact that I was constantly getting sick every time I had to access my port. So I did not understand it. I couldn't understand it. It was driving me insane because it didn't make any sense that every time I access my port, I would normally towards when I'm due for a new treatment and post, I get fevers. That's common because of my autoimmune. But for some strange reason, this go around, I have been having complications every time I have to access my port. So I'm going to show you this. I'm on clindamycin, which is this pill right here. And as you guys can see, that's red. And I'm allergic to the red part, the red dye that's in this. So I have to I'm taking my Claritin for my allergies, but I also have to take Benadryl. Don't take it the way I do, guys. I have been on Benadryl for decades in the liquid form. And when you're in the military and you're out in the field or overseas or whatever, you're carrying this stuff, you don't take, nor do you keep track of the little cups that come with this. And so I have learned what the sensation of the fluid is, of exactly how much my dose is in my mouth. I typically take more than the 10 mLs. I normally take up to 20 mLs. So I know exactly how much 20 mLs is equivalent in my mouth. Yuck. Hate this. Anyways, I do the same thing, ironically, with cough syrup. So that is my stand being interesting right now. All right. Ooh. The burn going down. I should have been on dose number 2. I've been up since 5 o'clock this morning, but that's my first dose. Okay, so I have tried going to school, but then all of a sudden, out of nowhere, the longer I took this medicine, like within the first few days, I would take the medicine. I tend to get hives internally. So I'll get hives in the back of my throat, on the back of my tongue, and it'll go part way. It doesn't go all the way into the throat full on, but just say the back of the throat and stuff. I'll get all these little hives on the interior part of my mouth and throat from the red dye. And so eventually what happened was, me being me, I'm studying for exams. I wasn't really paying much attention to what my body was doing because I was so focused on, I got to get study, I got to study, I have to study, because I had midterms that I had to do, and I wanted to score. I had to do midterms, but then after the midterms, I had two midterms I had to retake. So I retook those two midterms, and I wanted to do well. So I was really, really prepping and preparing just so that I could score well. Well, needless to say, I wasn't paying any attention to what my body was doing, other than my ears and throat were itching a lot. So even though I take Claritin and Zyrtec, I take up to 2 Claritins a day. Sorry, this is Zyrtec. I can take up to 2 Zyrtecs a day. Usually I'll take them in the morning. And then, and they're like a long or second generation version of Benadryl, to be honest. That's what they are. And then I'll take Loratadine or Claritin at night. I take 2. What I started happening was, originally I can take up to 2. I was taking 1 in the morning of the Zyrtec, and then 1 of the Claritin at night. I started waking up with my ears and throat being extremely itchy, and apparently me trying to scratch my throat the usual way folks do, using your tongue, started creating an ulcer in the back part of my throat. So eventually what happened is, it's like what's going on now. I started having issues with my voice, cutting in and out, because my airway started constricting a little bit, because of the allergies from the medication. I am working on trying to do better with that, but it is what it is, guys. So anyways, I started having real bad reactions, and I didn't pay it no mind. Like I said, I would go to school and I was sneezing a lot, and I started getting sinusy. My allergies just started cutting up really, really bad. I would itch a lot, scratch. Again, 2 and 2 weren't coming in together. I wasn't paying no mind to the antibiotics, honestly. So I decided, my housemate came to me and she's like, have you realized that your face is swollen? I was like, no. But I noticed that my lip is itchy. Because I started, my lips started getting itchy and tingly, and then it started to swell. And so I hadn't even looked at the actual face itself and realized that my face had started to swell. And so both her and my daughter separately came to me and like, yeah, your face is swollen. I think you're going through an allergic response. And my daughter's like, Mommy, you're going to need to use your epi. It's that bad. And I was like, well, that kind of explains a few things. I don't know why I wasn't paying attention to my body, but I wasn't. And my vocal cords had started to close up, like my throat, my airway started closing up, because the response actually got worse from the moment they told me that until where I started losing my voice, cutting in and out, and then it got to the point where my throat just started closing up altogether. So I had to do a round of epi, followed up with prednisone, and then all of this. So have I been recording? No, guys. I've been a little out of it. Hey, I haven't even been doing my daily posts, because I'm notorious for doing my morning prayer, my morning posting my morning prayer, my morning quotes, and my morning prayer, quote, scripture of the day. Those are my 3 that I post. And then on my individual page, I usually will post like something for the day. Let's go over some scripture, let's do some reflection, how do we apply some application, and how can we apply to our life? Just thoughtful, insightful type stuff that I like to post on my page to offer encouragement, to help walk people through their trials and tribulation that they may be going through. So I think what's funny is I actually had a classmate tell me, okay, so let me back it up a little bit. So what it is that the fevers turned out to be, and clearly you can tell I haven't had Strattera, but my ADHD meds, the infection turned out to be, I was septic. My port is infected with staph epidermis, and so is my blood. It's all the way into my blood. So what we suspect has been going on is that my port has been infected the entire time. And that's something that's very common with implantables. So I'm going to have to get the port removed and a new one put in. unfortunately. But we don't have much of a choice on that, but that's what needs to take place. Um, I thought I was good, but no. The infection has gotten to the point where I'm technically septic, or I became septic. It explains the reason why I was constantly running a fever, why whenever I would access the port it started out like within an hour of accessing the port, I would get sick. That went from within an hour to within 10 to 15 minutes, under 20 minutes. I would access the port and I would have a raging fever. And I'm not talking about a 99 temp, which for me is the equivalent of 101 temp, because my normal temperature is 96.8. I run cold, not hot. And I think the problem I run into is a lot of people automatically assume that, oh, well, you have a fever, it's only 99. Yeah, that's if it's a low grade to those who have a normal body temperature of 98.6. But again, I'm 96.8 is my norm. So 99 is pretty bad for me. But I was running 101, 102 temp up to 103, period. So that would be an equivalent to like a 102 to 105 fever for me. So let's just say I was boiling inside my head most of the time, and it was driving me insane because it did not make sense to me. I did not understand why I was having so many issues with, I couldn't understand why I was having so many issues with everything that I had going on. And it was literally making me insane. Because I was constantly talking to my doctor, letting him know what was going on. He was confused as well. He's like, we got to figure out what's going on. So I did a little bit of research and told him, this is what I think it is. Let's run 2 tests. Let's test my port separate from testing peripheral or from the arm. We tested both. The first test was negative. The second test was negative. But we did those independent, meaning I wasn't actively fevering or anything else like that. So the third test I made them take, I was like, no, take them together. We're going to coordinate. We're going to do it the day of my infusion, and we're going to do it after I've already done my shower and directly after I put in my needle. No ifs, ands, or buts about it. We should be good. So this time, when he drew the blood, by the time the phlebotomist arrived to draw my blood, I was full fever. I was ready to pass out. I was I was just violently just sick. You guys, just really, really sick. This last go round, well, it got worse after, but for that one, I was just like, okay, I don't feel good. I'm ready to pass out. So he took my blood from both the port. He did 2 cultures, and then he took from my arm. Which was the peripheral. He did 2 cultures. Sent them off. They came back positive. Then we went through. My doctor sent me, because they run tests to see what antibiotics will be a good match. So the top antibiotic was clindamycin, and then I have to go through my allergy list and make sure that it's not part of my allergy listing, which clindamycin is not a part of my allergies. However, this particular clindamycin that I got here, like I showed you guys, has red dye. The clindamycin I had in the past was green. So I did not even know that they came in any other color besides the green capsule. So that has been the hiccup. So I had, prior to, like maybe a week and a half prior to my infusion, I was having post-infusion anaphylaxis, which was related to other things. Because I usually get my allergies normally get a little bit more sensitive, or I become more reactive post-infusion. So that was, again, normal. So I was like, okay, this is a little annoying and it's frustrating. So, I got everything cleared up, went back to school, did what I had to do because I had been out for a few days for the anaphylaxis, went back, and then started the antibiotics, and then started having anaphylaxis all over again, but it was getting progressively worse. And I was like, okay, this is sucky, but we're going to do what we got to do. And then I would go to school, and then I would leave and just come home and go to bed. And I would do that because I was just tired. I was just extremely tired. I had to do Benadryl every 4 hours because of the previous bout of anaphylaxis, plus the prednisone, and that was just to tamp down the reaction of me going into anaphylaxis all over again, because I tend to have an anaphylactic response, and then in under an hour I'll have another anaphylactic response again if I don't immediately start the other things, which means Benadryl and prednisone, in order to calm my system down. So that's what we did. Weeks have gone by. I'm on the antibiotics. Like I said before, my housemate had told me, "Oh, you're having a response," and that kind of made everything click. And I started doing a true assessment of myself. I was like, okay, let me do my protocol for when my allergies are this bad, which means double up on the Claritin, double up on Zyrtec, and if need be, add in Benadryl when I have those breakthrough symptoms. So I increased my Zyrtec, increased the Claritin at night, and it was relatively okay. But then I started having more issues, and then eventually I went into anaphylaxis again. And at that point, we decided it would behoove me to stay home because I was dealing with hives not only in my throat, but I had started breaking out in my face, on my arms and stuff. And I'm sorry, I ain't going nowhere with my face with a rash all over it. Yes, I'm that vain. I think anyone would be if you have it to where your face is broken out with hives. I had hives internally, like I said, in my throat. And then I started having hives on my arms and my chest. I was like, yeah, I'm over it. Zyrtec. Sorry, that was Strattera. I can't deal with my brain not go. I have homework to do today and some studying, so I need to take the meds now so they can kick in time. But anyways, I was also scratching my face. My nose was red. My cheeks had started scabbing because though I keep my nails relatively cut low, I had literally started scraping the skin off my face, which is a bad habit of mine. When I get itchy, I scratch. I'm human. That's why I don't really grow my nails out very often either. It's because I'm prone to hives and scratching. Anyways, so I talked with my doctor, consulted him, and said, hey, let me stay home until I finish up the antibiotics. Technically, these antibiotics were supposed to be done tomorrow, but they're not, because I'm supposed to take these every 6 hours. So that means at minimum 3 a day. But with the Benadryl I've been taking 2 a day, which has actually expanded. 6, 8. I have 16 here plus 2, so I still have 20 left. But I was supposed to be done with these tomorrow, Sunday, so that I can return to school on Monday, but I won't be. So I will be going to school because I have a whole bunch of quizzes I need to take and I still need to finish up these antibiotics. So I'll have to talk to my doctor, let them know, hey, yeah, I know you said every 6 hours, but I've been making it maybe because I'm sleeping for most of the day. I haven't been getting in the minimum 3. I've been getting in a minimum of 2 a day. And I know that he's going to probably want to do another culture to see what my blood is looking like. And I do need to go back to school because I have a lot of quizzes to make up. I have 3 quizzes, quiz 1 and quiz 3 for all of my classes. But I'll message my doctor today later and let him know, hey, I'm still not done with the antibiotics. I still have a significant amount left. So 2, 4, 6, 8. So 16. 16. 16. I still have 16 of these left. Um, and I'll be honest, guys, I've never really been good at medicines that go for such a long period of time. Low key. Um, I'm afraid to double up on these, only because of the response I'm already having. And the fact that this stuff is nasty. It really is. All right. But anyways, it's only like a 300 milligram dose. I mean, I may be able to increase it in order to get through them faster, but I'll have to consult with the doctor, um, and then stay home a little bit. I may have to stay home next week too, and then go back um, after, which means I would be going in for CCBS, my finals for that, the following week, I think. And then I would have to do my quiz 3 and quiz 4s for the other classes by the time I return. So I have a lot of studying to do. And I have to make sure that everything is locked in, that I score well, because I need at least a B on every one of the quizzes that I take. And then on my finals, I need to score extremely well as well. So that is what I've been going through. I've been dealing with, like I said, I've been dealing with septicemia. That's what the condition is called, or a blood infection. Most people, you end up in a hospital, you get IV antibiotics, but again, I'm overseas. I stay away from the hospitals here. I have most of the equipment that I need already here. As you can see, I have my machines here. And that's for gaining fluids. I have a case and a half of fluids over there to bring in fluids as I need it. I'm still running fevers because my air conditioner has actually had to be lowered. I am normally cold at about 78. This thing has been lowered, I want to say to 22. 24, well, it's been lowered to 24. It was as low as 22 degrees Celsius, which is about 70, 68-ish or 70, I believe. I'm not sure of the conversion. That's what my handy dandy phone is for. What is 22 degrees Celsius in Fahrenheit? So 71. It's been lowered to 71.6. For some of y'all, that is a great temperature. For me, no, that's freezing. And I enjoy, you guys. I'm putting on a great smile here just because I don't want to present myself as being a miserable little cuss. I want you to see that even in spite of being very ill, because I haven't told you the worst of. The worst of it was this last go infusion, which I had Friday. I plugged in within 15 minutes. I was not feeling well. I had hooked in for fluids. I was getting my fluids. I hadn't started my actual infusion or sub-Q IVIG yet. I was like, oh, I'll get fluids for an hour and a half, and then I'll do the sub-Q for the remaining time that I had left. So that's what I started doing. And then all of a sudden, I was like, mind you, I'm on the antibiotics now. I'm like, wow, I don't feel good at all. I had eaten, I had done everything I was supposed to. I didn't take antibiotics on an empty stomach like I just did just now, which was stupid. But I was like, okay, I don't feel good. Let me unhook. So I disconnected from the fluids. I went to the bathroom, and as I was in the bathroom, I make the joke I'm allergic to vomiting, because I really, really don't like to vomit. And usually when I get the sensation that I need to, I can usually mind over body. I can normally get my mind to get over the situation. But in this case, my body was like, nope. It wanted everything out. So the last time I had this type of symptom where I'm coming out, as we say, both ends, top and bottom, was when my gallbladder shut down and I had to have it removed. Same symptoms. I was going top, bottom, And then I had come back, and my body was like, nope, we're still wanting to vomit some more. So then I had to run back and vomit some more. And then I came back and had to go back. So I had to go back and forth a few times because my body was just trying to get rid of what I'm allergic to, which is the dye. Um, so that became an issue. And then I started fevering. And normally, once I start my infusion, my IVIG, normally within the hour, 30 minutes to an hour, the other symptoms start to tamp themselves down and they go away. Well, some strange reason this time around, didn't happen. I stayed miserable as sin the entire night. So that means full body aches, lots of pain, all of that. I reported that information over to my doctor, and he was like, well, we need to put you on something else. I'm like, well, let's just finish this off. Let me tough it through. Let's just finish this off. I'll just increase what I'm taking. I'll take the Benadryl, which at that point, I had increased all my class 2s, the Zyrtec and the Claritin, but I hadn't started doing the Benadryl every 4 because I had stopped doing it. And then I was like, well, I guess I'll go back to taking the Benadryl every 4 hours to kind of like help my system. So that's what I started doing. And then, so that was Friday, miserable for the whole night. Next day, I woke up, I felt much better. At least, no more aches or whatever. But then within I want to say by Monday, Tuesday, no, I was in bed from Friday. I've been in bed since Friday, pretty much. And we're Saturday, the next week. So I've been in bed for over a week. And then I've been sleeping off and on, like pretty much the entire day, since since Sunday of last week, because it's Sunday tomorrow. So yeah. And that's because I take the Benadryl. I try to stay awake while on the Benadryl, but then I started noticing that the combination of the Benadryl, because Benadryl kind of slips past that blood-brain barrier for me very easily. And so I kind of get a little out of it. I don't like it for that reason alone. I don't like anything that makes me, or that affects my way of thinking beyond my Stratera. So I ended up getting to the point where my body was like, look, we're tapping out for a while. We're going to rest and recuperate. You're not going to push us anymore. And my body just shut down for a while and just needed rest. So I literally would sleep. I slept. I have slept nonstop. I got up this morning and looked at my face and I was like, wow, I look old and dried out like a Christmas tree. Because there's no moisture in my skin. And then Tuesday this week, I started my cycle, which means whenever I menstruate, it causes another, immune system storm. And usually that's when I am more susceptible to viruses and infections and all the other stuff. I've always had that issue. I don't know why. I think it's because my immune system is relatively shot. But it's been that way for a while. So then I was okay, and now I'm really feeling draggery. There's another way I want to say that, but I'm going to keep this clean without profanity. But because of that, I was like, wow, I'm not here. So I think the heavy flow and everything else that I had going on just made it to where my body was like, look, we're going to tap out. You're just going to rest. I would try to get myself up and get cheerful to try to get up and out, but my body would still shut itself right back down. I'd go back to sleep and sleep the entire day. And I would try to wake myself up, try to get moving, and my body would conk right back out where I was not fully in consciousness. This is actually the first day that I'm cognizantly here, that I'm cognizantly present. I think my body is starting to get used to the amount of Benadryl that I'm taking right now with the antibiotics. I'm getting a little bit used to it. Just a little bit. I still don't like it. So that's just my reality. But I think it's funny when most people who see me don't see my autoimmune condition. They don't see the multiple autoimmune conditions. They don't see the septicemia. They don't see the things that I'm battling because I have learned to put a on it. So because I can smile and joke and kind of push through my day, most people never truly know how desperately sick I actually am because I never let it show. Not even from my daughter. She sees it a little bit because sometimes I'll let that little shield that I have up fall. And then when I'm home, I'll moan and groan and do whatever I need to do. But when I'm out and about, I will fake it like there's no pain. I will tap it out. I will do what I got to do, but I have a limit for that, guys. And I think that's what most people don't understand. Yes, I'm a medical student. I'm in medical school. But by the grace of God, it's going to be in his hands whether or not I continue to move forward. And I think that he will allow for that to happen. Today is going to be a day of just studying. I will reach out to my physician and let him know, hey, I'm still having issues. You know, I'm still not through this medication because I've literally slept every day for the last week. So that's put me back. And so because of that, I may have to extend how long I'm out because I'm not where I need to be yet. And because I'm still running fevers, we have to get a breakthrough with the fevers. And that's, you know, the antibiotics combined with everything else. It's my immune system trying to do the little bit of work that it can. And the IVIG is what's giving me an immune system, honestly. If they wanted to really give another diagnosis to me besides the GPS dash AMAN, they could technically go in and say that I have immunodeficiency. I don't have HIV, guys. You have other immuno things that can compromise the immune system and make it to where you don't have an immune system. I don't have AIDS or HIV or any of that, but my immune system has been compromised because it has been dysregulated for over 16 years with the GBS not being properly treated. And that literally caused my immune system to kind of tap itself out. So when I get sick, I don't build titers to certain infections, so I can get repeat infections very quickly. I'll give you an example. When I go in and I get the flu shot, I have to get the flu shot twice in the 6-month period. I get them 3 months apart. I've had vaccines I've had to be re-given because I did not build titers to them. My immune system just doesn't care. It's going to do what it wants to do. Low key, bottom line, period. And I'm okay with that. I really am. But I'm also okay with the fact that people don't know the trials and tribulations that I go through. And because they don't know, they make assumptions. So I miss school, but I'm at home when I'm awake. When I'm awake, I try to do my best to study. But most times, especially for the last 2 weeks that I've been home, I have been sleeping, guys. I've been unconscious. So a lot of people assume that I'm at home and I'm getting all this studying in. In reality, I'm not, because I'm 99.80% of the time, I'll get it factual. 80% of the time, I'm sleeping. The other 20% of the time, I will get in some studying. It's the same amount of hours that I get in for studying that I would if I was going to class, honestly. Because I literally sleep. Actually, I'm getting in less study time because I literally sleep all day. And then I have to try to, and when I'm not sleeping, I'm fighting to stay awake. Because at the end of the day, my body is like, go to sleep. You're running a fever right now. Go to sleep. Your body is dealing with anemia. Go to sleep. You know, so the blessing I have is that now my cycle's coming to an end. I'll go through a phase where my body will kind of re-regulate itself. And then I'll be back to being able to push through. So I have to call my doc and find out what he wants me to do about the antibiotics. Because as long as I'm on the antibiotics, I can't go back to school. So I may be out for another 5 days, which for me is fine. I'll still push through and get through. I'll be seeing MD3s. I'll be MD3 next semester. And then I'll do my best to study as much as I can while I'm here to prepare myself. I'll be going through everything, not just sections. I will make sure that I go through and over everything so that when I take my finals, I have a clear understanding of all the information being presented, and I've gone through everything that I could possibly go through. I'll go through an entire course while I'm home and keep doing that. And then I'll go in, I'll take my exams, prayerfully do well, because I don't need an A, I just need a B. Let me get B's and everything. And on those quizzes, if I can get an A, even better. But if I can get a B, I'm glad. And that will keep me being able to, if I can get an overall B for the semester for all my classes, then I'll be able to maintain my scholarships, which I desperately need to keep, honestly. So, yeah, I'm excited, guys. But I think it's just amusing when you have people make assumptions about you. I have people constantly brag, or they're like, oh, you're a braggart because you're bragging about how well you did. I'm like, no, I'm actually shocked that I actually was able to do better than some. If I'm able to get better than the median of the class, I am happy, because that means that I am scoring with people that are going to class every day. And I'm missing 4 or 5 classes, or more, because of me being homesick. Kind of wish they would just make it to where I could do this by video, where they would do it and I could say that I could attend class by video. I actually need to talk to the school about that and bring that up, actually, because that would actually be a good recompense for me because of me being sick and not being able to be around people. It would make it to where I'd be able to get the information that I need, and they would be able to do the classes, and I'd be able to get the information while they were lecturing, and I'd be able to get it firsthand versus me just doing everything independently. Maybe I need to bring that up with the higher ups and see if they'd be willing to do that as a modification, because at the end of the day, my autoimmune is my autoimmune, and I'm not trying to repeat classes, guys. I don't like it. Things increased by $3,000. I don't have it. Being honest. And for people that are on a new curriculum for our school, it increases by $7,000 per class if you have to repeat. $7,000 per class. And ours is, if you have to repeat, is $3,000 per class. That's a lot of money that I just don't have. I have a kid. We have to pay for everything that's here. So I just don't have that. And that's not going to happen for me. So, yeah. It's been rough. It's been a rough couple of weeks. It's been a rough month. Since I got Dengue back in July, I've had a rough time since. I have been fighting one infection after another, and I think that's been the issues that I've had it back to back. Now, some of you may be thinking, oh, you must have didn't clean your site or something properly, so you gave yourself the infection through your port. No, I use a surgical scrub that I shower with on my skin as well as on my abdomen prior to me giving myself the jabs. And I also do the same thing on my hands to make sure that there's no bacteria or anything that's left behind. And then I glove also. Depending. If I'm doing my abdomen, sometimes I'll glove and then sometimes I don't. When I'm in the bathroom doing this, I always make sure that my hands have been washed, and I wash them again, even though I've used the stuff to take care of that. I'll use the antibacterial soap. I'll clean my hands again, dry them with a fresh, clean towel, and then I will sterilize. I'll wipe everything down with alcohol. Not 70, but 90% alcohol. I'll go over the skin again, so it's like a double cleanse, and then I access. So I don't believe I gave myself the staph infection, the staph epidermis infection, because at the end of the day, staph epidermis is a staph that grows on the skin naturally. Though I tend to be allergic to myself, so I wouldn't put it past it. But yeah, the doctor says he doesn't think that's what it is. He kind of thinks that my device more than likely was already infected. It's just that it took a while for me to start having a response. So I have a doctor's appointment on Monday to discuss with them having this swapped out, removed, and changed to a new one. And if they find that this isn't, I only have 2 implantables, this one and the one that's in my back. I have another implantable that's in my backside. But I don't think it's that, because I've had that implantable way longer than I've had this one, and this was the latest. So I think this is what most likely is the issue. So we're going to have them remove this. I'm going to see if maybe they can move it to the other side, just because I'm starting to build up a lot of scar tissue here. And yeah, it'll be interesting to be plugging in at this angle versus this angle, but you got to do what you got to do. So I'm going to see if they can maybe put it on the other end, the opposite side, but they may tell me no. And if that's the case, I'm going to ask them, can you lower it or raise it? Bring it up some or lower it a little bit so that, I get a new jabby place. Because I think that's what I would prefer, is just to have a new jabby place. I don't want to be jabbing where there's already, as you can see, scar tissue building up in this space from where I'm shifting and moving the skin to be able to jab into a fresh spot. So, yeah, we'll see. We will see. I think the other reason why I'm starting to build up scar tissue is also because I had a while, because it wasn't scarring before, but I think it's scarring now because post-Dengue, I was taking a longer time to heal. So, because it wiped out my white cells and my platelets and stuff. And your platelets is what help clot the blood, and it's what helps. It makes the lattice work for your body to rebuild that skin, that collagen and stuff there to, heal it. So I think me with the dengue fever, post dengue, and all of the stuff that I had, the complications I had post that, then me getting the infection, it is what it is. Other than that, yeah. So guys, remember, just because you see someone smiling, joking around, lollygagging with other people, don't mean that they're not suffering, because sometimes we suffer in silence. I'm in pain every day. You have people that have other conditions that cause them to be in pain. That's even more severe than the pain that I stay in. But I'm in pain every day. I learn to push through. I'm sick constantly, but I learn to push through. As long as I'm not contagious, I will continue to do what I have to do. Even as a practicing physician, I will still see and treat patients, and I will take the proper protocol, wearing masks, putting on proper barriers, and making sure that I will never do harm to a patient, because that is the medical quote. That will be that oath that I will be taking. So at the end of the day, I want people to remember, don't judge a book by its cover, and stop thinking that a person with a disability that you cannot see doesn't have it. Stop thinking that a person that's not showing you their weakness isn't weak and struggling every day, because they may be. The difference is that in my struggles, I am still pushing through. I refuse not to push through, and I am set on always setting an example for those that come up behind me, because I want you to understand that no matter what you're going through, no matter how difficult or challenging things are for you, that we still can push through. We still can make something of ourselves in spite of our disabilities. We can make something of ourselves in spite of our illnesses or chronic conditions or whatever you want to call it. And we can make that our testimony. My goal is to make a good life for my child, to travel, eventually get married. I'm old, guys. I'm old. I will not give my age, but I'm old. To become a physician, I would like to be triple board certified if I can. I would like to become a physician and I would like to get a residency if I can for emergency medicine and family medicine. Those can be done together. But I also want to do a residency for orthopedics. That was my first love that I wanted to do. I wanted to be an orthopedic surgeon. So I'm going to see if I can be. And I'm not stupid. I will never do anything that's going to risk a patient's existence. If I start having more issues with my tactile, meaning I'm not able to hold on to things the way I need to, or it becomes an issue, then I will step away and step out of that field and stick with emergency medicine and family medicine. but I want the opportunity to see if I can. So I'm going to try. That is my goal. I want to be triple board certified if I can be, and work on becoming an orthopedist as well as a person that has family medicine and emergency medicine behind them, and be certified in both, board certified in all of them. I may not go back to the United States other than getting all my stuff done. More than likely, I will be overseas. The United States in the climate that it's having right now is not for me. It's not for my child. I prefer to not have to have her engage in the foolishness that's going on currently in the United States. And I have open invitations to a few different countries at this point to go. I have many places culturally that I can go and blend in well. So I like being of Asian ancestry, Chinese, and so forth. I like being of Spanish ancestry, and I love being of African ancestry as well. And I can go back to any of these places. I'm also Native American, though, you know, the United States want to tweak things for that, but I know what my ancestry is. So at the end of the day, we're going to do what we have to, and I'm going to continue to push forward and push through. And I want you all to remember to do the same. Don't ever let anyone define you. Do not let your condition define you. Don't ever let anyone tell you that you can't. If God has placed it on your heart to do something, then do it. Move forward, pursue it. All in all, I'm going to say this. I wish you all well, and blessings to you all. Blessed be. Bye for now.
Thanks for watching. Like, comment, share, subscribe. Thank you.